So we're going to talk about SPD, or symphysis pubis dysfunction, otherwise known as pubic bone pain. And this can occur a lot of times in women who are pregnant. It can have an onset during labor and delivery, and many women can experience it in the postpartum period as well. And so let's talk a little bit about the anatomy and the muscles that can contribute to this. So this is essentially the front of the pelvis. This right here is the pubic bone. It's actually a right and a left half that's connected here by a little bit of cartilage. There are lots of ligaments and muscles that kind of help support this region. I'm gonna highlight just a few. So if we flip this over and we look here, these are actually pelvic floor muscles that attach on the inside of that pubic bone. Here, not present, is rectus abdominis, which is the superficial layer of your abdominal muscles. We also have superficial pelvic floor muscles that attach into the pubic bone space, as well as adductors or your inner thigh. So lots going on there. All those things have to coordinate and communicate in order to stabilize this joint. But if you're pregnant and you have extra weight through the system, you have a belly that's stretched out, you have a lot of pressure on this pelvic floor, we might start to get tight in our thighs. Plus we have hormones affecting our joints and our ligaments. We can start to get a little bit of an instability and pain here. This can affect everything from walking, going up and down stairs, moving into standing position, even rolling over in bed at night can become a problem. And then, of course, during labor and delivery, this joint actually has to move quite a bit in order to successfully vaginally birth a child. So in the postpartum period, sometimes what we see is technically a dislocation of this joint, which is that it's really separated and we can fill the space in between there. So it's important you consult with your pelvic physical therapist to determine what muscles specifically may be playing a role in your symptoms. Could be tight muscles, could be weak muscles. There's lots of things we can do about it, from breathing correctly, using an exhale to get some stabilization, maybe a Sorolla belt, and avoiding asymmetrical activity can help all this heal. So talk to your therapist about what's best for you.